Friends, I am sure you have met people who have complaints of joint pain, swelling and tenderness, and their doctor has told them that their uric acid is high and they have gout. Almost 50 to 80 lakhs of Indians get gout, and somehow most of these are men, and most of these come from people of middle or higher social strata. That does not mean gout does not affect people from lower social economic status. They do. It does. But commonly it affects people of higher social economic status. More and more people are now getting gout. Incidence of gout is increasing in India, mostly because of the modern lifestyle that we have adopted. In today's video, we shall have a look at gout and its implications. I am Dr. Prasad, Honap, a consulting physician, and you are watching Let's Talk About Wellness. Gout is a type of arthritis that has been recognized for thousands of years. Gout was known to ancient India and has been described by Charak, the great Indian physician. It was also known to ancient Greeks such as Hippocrates. Throughout the history, many highly famous people or celebrities have been affected by gout. These include King Henry VIII of England, Benjamin Franklin, the American founding father, also had gout. He wrote about his experiences with the condition. Sir Isaac Newton, the renowned scientist, is said to have suffered from gout. In 1773, a session of House of Commons, when William Pitt the Elder was absent due to gout, the British Parliament voted to heavily tax the imports of tea from American colonies without levying taxes on other tea imports. This decision was the precipitating factor for Boston Tea Party and helped to spark the American Revolution. Gout is a type of arthritis that is caused by high levels of uric acid in the blood. The uric acid is product of metabolism of substances which contain purines. When this uric acid increases, its level excessively gets deposited in joints, its crystals get deposited in joints and they can cause inflammation. The impact of gout on the body can be significant. It commonly affects the joints, particularly the big toe, but can also affect other joints such as ankles, knees, elbows and wrists. Gout attacks can be extremely painful and can cause swelling, redness and tenderness in the affected joint. The pain and inflammation can be debilitating, making it difficult to perform everyday activities. Gout is more common in older adults, particularly men over age of 40. Men are more likely to develop gout than women. Family history of gout increases the risk of gout. Excessive weight puts a strain on joints and increases uric acid levels. The diet consuming foods high in purines such as red meat, seafood and alcohol can increase uric acid levels. Certain health conditions such as high blood pressure, diabetes and kidney disease increase the risk of developing gout. Certain medications such as diuretics and low dose aspirin can increase uric acid levels and thereby increase the chances of getting gout. What are the signs and symptoms of gout? Most important symptom of gout is joint pain. It affects very commonly big toe but can affect other joints also. Along with pain, there is swelling, redness and tenderness. If you touch that joint, it has become very sensitive. It causes tenderness. This is the most important symptom of gout. The other symptoms are limited range of motion. Gout can cause stiffness and limit the range of motions in affected joint. In chronic cases, small white chalky deposits of uric acid crystals called tophi may form under the skin around the joint or in other parts of the body. Gout can lead to the formation of kidney stones, which are hard deposits of uric acid crystals, and that can cause severe pain and discomfort in the urinary tract. Repeated gout attacks can cause damage to the joints, leading to chronic inflammation, joint deformities and reduced mobility. Let's, in short, see what are the treatment options for gout. First is of course medication. Your doctor would prescribe you necessary medication, and I won't tell you in details what medication or doses of that medication that you should take. For this, you should depend on your doctor. Your doctor will also advise lifestyle changes. Maintaining a healthy weight can help reduce the risk of gout attacks. Regular exercises can help manage gout symptoms and improve overall health. Avoiding alcohol and limiting the consumption of high purine foods can also prevent gout attacks. Limiting the intake of foods high in purines such as organ meats like kaleji or brain, seafood and certain vegetables can help to reduce the risk of gout attacks. Increasing water intake can help flush out the uric acid from the body. Consuming low-fat dairy products, cherries and foods rich in vitamin C may also help prevent gout attacks. Let's now quickly see which are the foods that you must avoid and which are the foods that you can consume without fear if you have gout. The foods that you should avoid if you have gout are the foods which contain high purine, because that would lead to high uric acid levels. And these foods are organ meats such as liver and kidney, red meat such as beef, lamb and pork, seafood such as scallops, sardines, anchovies and mussels, game meats such as rabbit, etc., processed meat such as sausages and hot dogs, etc., mushrooms, spinach, asparagus, cauliflower, beans and lentils, and alcohol, especially beer. Foods that can be eaten even if you have gout are low purine foods such as low fat dairy products like milk, yogurt, cheese, low fat cheese, vegetables such as broccoli, carrots, etc., fruit such as berries, cherries, oranges, apples and bananas, whole grains such as brown rice and whole wheat, etc., legumes like lentils, chickpeas, kidney beans, tofu, nuts and seeds like almonds, walnuts and chia seeds, and healthy fats such as olive oil, etc. Anti-inflammatory food products such as turmeric, ginger, garlic, leafy green vegetables, nuts, olive oil, green tea should also be encouraged. Friends, I am sure this video has given you good information about gout, a disease which is becoming common in India because of our sedentary lifestyle. I am sure this will help you if you have gout, or if your relatives or people known to you have gout. Friends, please like this video, share and subscribe. Thank you very much.